So, constipation. What do you teach a patient about constipation?
Fiber.
What kind of diet they should be on? Lots of water. Lifestyle. Moving. Gets their peristalsis moving. That's why part of the reason why after surgery, you know, not just to prevent clots, but we want you to ambulate is to get your bowels going again. So know that. Esophageal varices, know the medications for that. Esophageal varices. So just, you know, constipation, I saw 2 questions. Esophageal varices, I saw 1. Perforation of a peptic ulcer, there's about 3 questions on that. So know the signs and symptoms. Perforated peptic ulcer. Okay. And then no post-op care for abdominal surgery. Just what to do with those kind of patients, abdominal surgery, post-op care. Okay. And then there's about 2 questions on EGDs. So you want to know what the purpose of an EGD is. And then what to teach your patient about pre-op. So EGD, scope down this way. Colonoscopy, scope down that way, right? So, but they're both scopes. Okay, so there's about 2 questions on that. And then NGT, so a patient has a nasogastric tube. What are some of the findings that you would want to report to the provider? If somebody has a nasogastric tube, is it the amount, the color, consistency? So you want to know, because it's going to say the nurse finds NG tube like this. And then what do you report? And then the position. So if somebody has a nasogastric tube, what's their position supposed to be in bed? Supposed to be laying down? Sitting, yeah. Semi-Fowlers. Especially if they're getting, well, if they have an NG tube, they're getting feeding that way, that's one thing. But if they're getting gastric contents removed, they should always be in semi-Fowlers. And the thing too is because this happens a lot in the hospital, just in settings where nasogastric tubes, you know, you have the tape on their nose, but sometimes it moves up, and then it's like going up their esophagus, but now the contents it can make them aspirate. So you always want to make sure nasogastric is in place. So when you guys are giving medication, you always want to check placement. Even though it's already been verified by like an x-ray, you always want to check placement before you give meds. So just know the findings to report and the position of the patient. And then there's a question about bleeding duodenal ulcers. What are the signs and symptoms? Duodenal ulcers. Okay, the next, GI bleeding. What are the procedures to check for any GI bleeding? And then what to monitor if somebody's bleeding? Like labs, you want to see their CBC, H&H. What other things should you be monitoring for? Okay, and then next is GERD. There's about 6 questions on reflux, so get to know your GERD. This is a very common condition. What are the things that make it worse? Like the foods they eat, we talked about spicy foods, caffeine, you know, lifestyle stuff. Stress, yes. And when is it worse? Like after they eat, and then you don't want them laying down right away, you want them propped up a couple hours. Yes, so complications of GERD, signs and symptoms of GERD, diet, what to avoid, what to teach a patient with reflux, and then medications. We talked about like the antacids, the H2 blockers, the PPIs, which in that order, which works the quickest, which works, you know, a couple days later. So get to know the medications. Back to EGDs, you want to know what priority to monitor if somebody has that procedure done, EGD. Okay. Yeah. And also during, if it scope done. And then there's still calculations, but not as much as, I think last time there's like 10 or 11. This one's there's, I counted 4 calculation, but they're liquid IV calculation. I think you guys can't handle. You guys are looking at me like, I don't wanna see those. So calculation, so make sure you have paper and pen. Another one, peptic ulcer, know the medications for peptic ulcer, how do you treat it? Okay, next is know the process of digestion. Remember, digestion starts where? In the mouth, and then just know where it goes and where it ends up. Well, you know where it ends up, but you from the mouth, in between the mouth and the rectum. What happens then? Okay. And then no acute gastritis, teaching the foods and medications for somebody that's experiencing an acute gastritis episode. Okay. Do you guys know what AMA is? It's fundamentals. Against medical advice. So somebody was in the facility, they're getting, medical care, they can't just leave. They have to sign something called against medical advice. Meaning if they leave, it's against our advice to them that they should stay and get treatment. So if something happens to them down the street, they're not gonna blame the hospital because you guys let me go. So when they sign that, that means we're not liable. Yeah.
I've heard mixed things, which is the reason why I'm asking, but what do you do when a patient refuses to sign an AMA and just straight up walks out the door?
Yeah, I mean, I've had patients that I go in the room and they're gone. They even made the bed.
Nice.
So they thought it was really nice to make the bed. I mean, you just put that patient left without being discharged.
Have a witness.
What's that?
A witness.
Yeah, you'll have the charge nurse there, like patient's gone, there's not here. I've left patients with central lines and then like a drug addict, so he was gonna maybe shoot himself,
Yikes.
So it's, you don't wanna be all of a sudden he shows up in the ER and he OD. So we chart those things.
Yes, sir.
So, yeah, but AMA, if they're like, I gotta go, and so make sure that you know what that form is. Yeah. Okay, hypovolemia, it's due to blood loss. Know the signs and symptoms. Hypovolemia. So when you have blood loss, what are the signs and symptoms? Like tachycardia, low blood pressure. You guys know. I think I put 2 questions on that, so. Okay, and then what's an OB test? What is that test for?
Like a stool test? The OB stool test?
The fecal blood.
Yeah, stool test. So it's just testing to see if there's any blood in the stool, because some things are, microscopic, you can't see with your naked eye. So know what that is. And then know what is malpractice, assault, battery, and abuse. Some questions I saw, it's not really related to GI. I think it's just going back a little bit. So that wasn't a GI thing, malpractice, but just know what it is. Malpractice, assault, battery, and abuse. Okay, and then, like I said, some questions are not GI, but it's just going back. MRI, what is it? What do you teach a patient? You guys learned that last test. So MRI. Okay, and if somebody was experiencing vision loss, what's your priority teaching, your action for that person, for that patient? So vision loss.
Meaning like nursing intervention?
Yeah, teaching the patient and nursing interventions, both. Like what's your action? Okay, and then again, going back, wound evisceration. What's your action when the wound eviscerates? It's going back again. Almost.
How many questions is this test?
I believe it was 60. I'll double check. What was the last test? Was it 30?
I think it was like 60 or 75.
I'm getting confused with all the tests. Let me double check after I do this. Okay, and what's the purpose of documentation? Right, they always say if you didn't chart it, you didn't do it. what's the purpose? Okay, and then going back, how do you find the deltoid muscle for injection? Know that? Not a GI thing again, but there's a question on it. And next, bowel obstruction. What are the signs and symptoms? Somebody that's having a bowel obstruction.
You say signs and symptoms?
Yeah, signs and symptoms of bowel obstruction. And then know your nutrients, know your carbs, fats, proteins. So if there's like a diet question, it's like what's, you know, and then list the carbs. You want to be able to identify what's a carb, what's a protein. So know those. I can't remember. Okay, privacy when taking a bath. How do you provide privacy for a patient when you're getting a bath done, bed bath? Yeah, how do you provide privacy for a patient? So it's like just another fundamental question. And then the other one is you observe a nurse doing something incorrectly. What do you do to correct it?
Go like ethics.
What do you do? Like, do you talk to that nurse? You say something in front of the patient? Do you put her aside? Do you let it go?
You said ethics?
Hmm?
You said ethics?
It's kinda, yeah, it's ethics, but what do you do if you see something incorrectly done? Report her, write her up, and him up. Okay, last but not least, preventing needle sticks. So teaching how to prevent needle sticks. Again, not GI, but going back. That's your whole test.
Thank you.
That's it. Let me see how many questions.